the issue of long-term health care is a challenging one. Both advocates and opponents acknowledge that most Washingtonians will need to address long-term health care costs. Medicare is an important federal program, but it doesn't cover many of the day-to-day needs of older Americans. And so it was in this spirit that the Washington State Legislature passed and the governor signed the Washington Cares Bill. It was a first of its kind piece of legislation that collected a 0.58% payroll tax to build a fund that provides eligible Washingtonians long-term health care support with a lifetime benefit of $36,500. But as we've seen, first is not without its challenges. Critics point to the fund's cost. They point to its solvency, its eligibility requirements, and the challenges for opting out. Initiative 1436 sought to challenge the Washington Cares Act, but failed to get enough signatures to make it onto the ballot. Nevertheless, in January of this year, both houses of the legislature voted to delay and amend the Washington Cares Fund. So since this is sort of a moving target, our goal here today is to think more broadly about the legislation, basically trying to answer the question, is the Washington Cares Fund good for Washingtonians? And there's no easy answers, so a debate, as I tend to believe, is probably a good way to examine a thorny issue. And so we are joined, thankfully, by two experts who are deeply invested in this issue, are going to help us think through it. So let me go ahead and introduce them now. So arguing for the affirmative, we have Jess Gomez, who's with SEIU 775, and she's a coalition manager for the Washingtonians for a Responsible Future. Her career includes 15 years of public policy and advocacy, working with governments and nonprofits to bring about change in their communities. She's led multidisciplinary teams, worked directly with legislators and other decision makers, led coalitions, built communication strategies and for impact and across multiple sectors, including labor, public health, reproductive justice, and voting rights. So thank you, Jess, for joining us. Arguing for the negative, we have Elizabeth Hovde. Elizabeth spent a decade as an editorial board member and columnist at the Columbian newspaper in Southwest Washington, winning several Society of Professional Journalists awards. She was a political columnist for the Oregonian for 10 years before starting her current position at the Washington Policy Center. So today, our resolution is the Washington Cares Fund is good for Washingtonians. And the format is as follows. So we're going to start with the affirmative and negative, each taking 7 minutes to make their opening case. Then we have 2 rounds of each, the affirmative and negative, taking 4 minutes to rebut the opposing argument. And then we end with each side taking a 5-minute closing argument. I want to thank both speakers in advance for their willingness to participate in this and also for being really easy to work with. That was great. I like that. The debate itself is sponsored by the UW Center for Speech and Debate. The center is dedicated to the promotion and education of effective and responsible speech and argumentation through community events just like these, as well as through consultations, classroom visits, and one-on-one coaching. And so now we can begin. Let me get this moved out of the way. And we will start. I'll move my pen here. We'll start with Jess Gomez. I will keep the time and let you know when your time is up. Hopefully I won't have to interrupt you too vigorously or too much. But we will go ahead and begin with Jess in her 7-minute opening argument. So whenever you're ready, Jess.
Thank you so much, and thank you, everyone. Nice to meet you, Elizabeth.
Nice to meet you.
To start, I want you to think about your family, your mom, your dad, your grandmother, and imagine that they're in their later years in their own homes and one of them has a fall. Suddenly, they need help with things that they used to be able to do on their own, like bathing, getting dressed, and even going to the bathroom. Who would take care of them? Would you be able to? Would you put them in a nursing home, or would they want to stay in their homes with the help of a caregiver? What would you choose? And more importantly to this debate, how would you pay for it? WaCares is good for Washingtonians because it helps families provide care to their loved ones when they need it, helps keep people in their homes, and gives families a critical lifeline to affordable, quality, long-term care. By 2040, there will be more older people in our country and in our state than children. Imagine that. It's a really dramatic shift in the American population that we've never seen before. 70% of us in this room will need long-term care at some point in our lives, but we don't know it or we simply don't want to face it. And 90% of us won't save enough to cover it. Most seniors haven't saved enough for retirement, and it's no surprise why. The median income of seniors in Washington is only about $56,000. And of course, those numbers look much worse when we aggregate the data based on race and gender. Most people mistakenly believe that Medicare or traditional health insurance will cover caregiving costs. In fact, there are limited options for paying for long-term care. You pay for long-term care out of pocket and quickly deplete savings, pay for an expensive long-term care insurance policy if you can qualify and have no pre-existing conditions, or you meet the income qualifications for Medicaid. Only the independently wealthy and higher earners have the cash to pay out of pocket or purchase private insurance, leaving the middle class, those that don't qualify for Medicaid but don't have enough to pay out of pocket, in a dangerous uninsured gap. These middle-income seniors with modest retirement savings realize too late that their only option is to spend what savings they have to pay for care until they have less than $2,000 in assets, and only then will they qualify for long-term care through Medicaid. Statistics show that the majority of caregivers are women. Whether we're taking care of our children or our parents or even our spouse's parents, it's more often women that are relied on for this type of unpaid labor. Many women are forced to quit their careers in order to stay home and care for loved ones. Family members who step up to take care of their aging parents spend on average over $7,000 a year for caregiving. And that doesn't include the wages lost when they have to leave their jobs, an average of about $300,000 over a lifetime. In an attempt to mitigate the coming disaster, a group of aging and disability advocates, caregivers, including AARP, the Washington Areas on Aging, Moms Rising, SEIU 775, and other community organizations came together with policymakers to study the best ways to approach the issue of long-term care. In 2015, at the urging of the coalition, the state legislature instructed Milliman, a premier actuarial analysis group that studies financing healthcare, to study potential long-term care policy options. Two primary models were considered: a public-private partnership to help stabilize the troubled long-term care insurance market, and a public benefit trust similar to Social Security paid into by all workers. Milliman found that a public-private partnership to revive the private market would require huge state subsidies to private insurance, and that even then, the number of individuals who could afford to purchase meaningful long-term care coverage wouldn't increase substantially or cover more than 10% of the population. In contrast, Milliman found that the public benefit would cover a substantial portion of Washingtonians and have a significant impact on both family and state budgets. WaCares is a public benefit trust or a social insurance program that we all pay into a little while we're working. As the professor said, about 0.58% or $12 per paycheck for the median earning Washingtonian. So similar to Medicare or Social Security. When you need long-term cares, WaCares will pay out a lifetime benefit of $36,500 adjusted to inflation. Unlike private insurance, you can use it to pay for a variety of supports, from paying for family caregivers, thus bringing women's labor into the paid workforce, to paying for home care aids, wheelchair ramps, accessible bathroom modifications, and much more. Opponents of this program would have you believe that $36,500 is an insufficient amount for long-term care, but much of this is because they don't understand what long-term care actually is. If you're like most people, when you think of long-term care, you think of a long stay in a nursing home. For people who choose to remain in their own homes, like most of us want to, $36,500 can pay for over 10 hours a week of in-home care for over 2 years. The other claim you'll likely hear argued tonight is that WaCares is fiscally insolvent and not financially stable in the long run. In fact, analysis by Milliman has shown that even with large numbers of people opting out, WaCares is solidly solvent through 2075. The insolvency crisis is actually happening in the private long-term care insurance market, the market that opponents claim has a better solution. Growing numbers of private long-term care insurance companies are filing for bankruptcy. Washington State Insurance Commissioner Mark Kreidler described private insurance insolvency as a looming giant and specifically called out 3 major insurers experiencing solvency crises in Washington. Together, these insolvencies would leave almost 30,000 policyholders who have paid tens of thousands of dollars in premiums, not only without the funds they paid in, but without the benefits when they need them. If we do nothing to address this looming crisis, older people, like many of our parents who spent their lives working and saving, will quite literally die in poverty in order to pay for care. Thank you.
Thank you very much. That was 7 minutes on the nose. Very well done. That's the speech coach. That's what we always aim for. All right. So now we turn and now we can go to Elizabeth for her 7 minutes.
I'm definitely jealous that she hit 7 minutes on the mark. I'll do my best.
All right.
Ready?
Yep.
All right. All right, it's true. We definitely have a long-term care crisis in the works with our graying population. Government and industry estimates, as you heard, show that about 7 in 10 of us will require long-term care services of some kind and at some point in our lives for an average of about 3 years. And it's expensive. In 2021, the monthly cost of a room in a nursing home in Washington State was estimated at $10,500. In-home care is also not cheap. It was estimated at about $6,500 a month by Genworth. Awareness of the cost and the probable need that you'll need long-term care is the silver lining to all this talk about the Washington Cares Fund and the payroll tax that will finance it. Awareness drives more people with resources to start investing in a long-term care insurance program or making sure they have other plans in the works. Knowledge is power, right? Still, I'd argue that while the Washington Cares Fund might be good for Washington's budget writers, who rightly fear an increased reliance on the state's Medicaid program for long-term care, it is not good for Washingtonians. And I'm not just talking about all the workers who will be paying in for a benefit they won't end up qualifying for, given various hurdles set up by the state. Even the low-income person who is in need of long-term care someday and who pays in less than he or she might someday receive back does not benefit. Money they could be using now to care for themselves and their families will need to be used to help finance the long-term care needs of other people who do have money or plans for long-term care, or just more money than they do. A government program that creates this wide a safety net and asks lower income wage earners to give money to people with higher incomes is not good policy. It is not compassionate, even though that's how it's being painted. Taking another chunk of their earnings for this program that they might not use limits their ability to provide for and save for whatever life needs they may have. You know, this is one of many life needs that could come up for them. And taking care of just this one is not good policy. The Washington Cares Fund is unpopular, it's insolvent, it takes away choice, and it's inadequate. I want to focus on that last one just for a second. Even if it was predicted to remain solvent, which it's not, it has always been thought to be unsustainable over the long haul. And that was even before nearly 500,000 people opted out. You know, right now we're seeing with the Paid Family Medical and Leave Act that it is not paying its own way, even though there's a payroll tax on people to fund this that was supposed to be there when people were in need. It's now running out of money. It's supposed to be insolvent this spring, and the state general budget is having to backfill it. So even if it was thought to remain solvent, which it's not, the lifetime benefit people are being promised is inadequate, and it's offering Washingtonians false security. In general, workers who pay 58 cents on every $100 they earn for 10 or more years, and who stay in the state, and who have 3 or more activities of daily living in which they need help, might qualify for $36,500 in a lifetime benefit that can go towards state-approved long-term care services. As I said earlier, the costs for long-term care are high. A person could go through this amount in 3 to 4 months, and the low-income worker who is in need, they'll be right back on Medicaid when that money quickly runs out. The state has not solved the coming long-term crisis in Washington. It has simply shifted more of Medicaid's long-term care cost onto the workers in our state, both low-income workers and high-income ones. The state is the only one benefiting from this tax. It has workers paying more for lawmakers' inability to prioritize spending and put needs ahead of wants. And while government should absolutely have safety nets for people in need, and it does, this one weaves a net that is far too wide. It isn't needed by everyone, and it won't benefit all those paying in. It takes away Washington's choices as well. Some of us plan to use our assets, care from family members, or private plans to handle long-term care needs. And we save for life needs in a way that fits our individual and family circumstances differently at different times in our lives. When you're the parent of a young child or a college student, for example, those might not be the years in which savings or investments are as possible as they are at other times in life. We simply don't need the state forcing us to take care of this one potential need among many needs their way. This coming program and payroll tax was passed by the legislature in 2019 and tweaked again in the 2021 session. It was delayed this January as lawmakers became aware of all its shortcomings. You know, there's great intentions behind this law, but the law is not only just flawed at its very basic root, it was written poorly and it excludes many people intentionally. Even though the government has fixed some of the law's most glaringly unfair details, I think to quiet people down, the Washington Cares Fund is not good for Washingtonians, the rich or the poor. The state needs to go back to the drawing table. I think it needs to revamp Medicaid rules that allow the safety net to be taken advantage of. It should reduce regulations and rules on buying insurance. It should get out of the private market to help the private market be competitive, especially with so many new members in it, and that will help it offer an affordable product. Most of all, the state needs to continue using its bully pulpit and creating awareness that people need to be better prepared for possible end of life assisted care. Taking money from W-2 workers to fund this program that a lot of workers don't want or need and that some won't ever use just doesn't work. Thanks.
6 minutes, 59 seconds. You were within 1 second of each other. So well done to both of you. All right. Oops. Yeah. So here we are. Now we enter into a period of rebuttal period. So we will spend 4 minutes hearing from Jess, extending her case, responding to the concerns, 4 minutes from Elizabeth, again, 4 minutes from Jess, again, 4 minutes from Elizabeth. So let's go ahead and now, let me shift this back over. There you are. And Jess. There we are. So we can go ahead and you can have 4 minutes to respond and extend your case.
Thank you so much. And thank you, Elizabeth, for your thoughts. I think one of the things that I heard you say was a fear of increased reliance on the Medicaid budget. And I think that hits on something important. This program can save the state up to $3.8 billion in the Medicaid budget. In addition to that, the people who are on Medicaid will continue to benefit. Those that I was getting a little feedback there.
Oh, we don't hear any here, so you sound just fine.
Okay, great. So yes, there is a fear of increased reliance on the Medicaid budget because that's bad for all of us, and it's especially bad for low-income earners in Washington state. One of the reasons for that is that the Medicaid budget and what is paid into the Medicaid budget has an income cap. So people earning at the highest rates do not pay in at the same rates that low-income earners do. And one of the hallmarks of the WACARES program is that everyone pays in at the same rate and everyone gets the same amount of benefit. It is a universal public benefit, and that's a key tenet of the law. Most people will pay in far less than what they will take out in order to pay in more than you would take out. You would have to be earning around $400,000 a year, which most of us don't. So essentially that is a rich person's problem, and those people can often afford to pay for long-term care out of pocket or pay for long-term care private insurance. What I also heard Elizabeth say is that long-term care is not a want, or that long-term care is a want and not a need. I would disagree with that completely. This is not a want. This is not a nice thing to have. This is absolutely a need in our community, and a need that is becoming ever more severe as the days move on. I mean, by the year 2050, 22% of the population will be over 65 years old. So it's the job of our government to be able to bridge the gap and not leave the middle class in a place of not being able to qualify for Medicaid or afford private insurance or pay out of pocket. The other thing I wanted to address is that this is not an unpopular program. Much of that public sentiment has come from misinformation stoked by opponents to the program and the private insurance market, who have a lot to gain from spreading misinformation. It is actually polling, according to AARP poll done last year, the majority of Washingtonians actually support WACARES, and the more that they learn about the program, the more that they support it. I saw even from the polling in this classroom, which I know some of you have done some reading and some studying of this issue, that I believe 38% were supporting the program. And that just goes to show that the more information people have, the more people support it. You know, we save differently for life and life needs because some of us are rich and some of us are poor. And if we leave it to that mentality, those of us who are poor will always remain poor, because one small glitch in their lives, 1 year of caregiving that WACARES could pay for, could send that family into poverty, could mean that they can't pay the mortgage on their home. So this idea that we all do things a little bit differently is exactly the gap that we're trying to bridge with this program. Thank you.
Great, thank you. All right, Elizabeth, 4 minutes. And you can begin whenever you're ready.
Okay, thanks, Jess. And just to clarify, I absolutely think long-term care is a need. My point was saying that the government was cost shifting onto workers to pay for the need so they could continue to pay for things that we don't need and pay for wants. So total agreement that this is a need we need to plan for, a need we need to save for, a need we need to budget for. So I just wanted to clarify that. It's definitely a need. Another thing, our polling shows the exact opposite, that the majority of people are against this long-term care program and its payroll tax. And it shows that that people dislike it the more they hear about it and hear about its limitations, its eligibility provisions, and so on. And when I looked at the AARP polling, it asked things like, are you worried you're going to be able to pay for it? And things like that. And that is not the same as showing support for a program or showing a lack of support. It shows that people are freaked out because no one's planning on this. Eligibility is key to all this, right? When we talk about people who are in need and people who aren't in need, and just some of the things that make people ineligible in the private market. You do not need to have 3 activities of daily life that you need fulfilled to qualify for a long-term care payout. You need that in the state plan. So it's a higher need level that can get you eligible. Also, if you move out of state after retirement, because you want to be closer to your kids or you want to be closer to the Arizona sun, you are not eligible for the program despite how many years you paid in. Even if you're vested, you're cut off. No money for you. Near retirees are also pretty much out of luck. While the recent legislative action took care of a percentage of that, they are not guaranteed the same lifetime benefit, even though they are one of the groups we're supposedly helping. Military spouses also were accommodated in that. But the idea of accommodating people who move out of state has not been solved. They don't expect to solve it because it creates long-term insolvency, more of it. I want to address something that Jess has said about only the rich can afford long-term care. That's simply not true. I'm a single mom who works for a nonprofit, and I have a long-term care plan that I can afford. And it's a better payout than the state would have offered me at the end of all of this. So checking into the reality behind that is key. But a lot of us, there's some talk that we're avoiding this, it's a big problem, and we're trying not to think about it. I think a lot of us just haven't thought about it yet. I just turned 50 years old. I have never thought about long-term care until I heard about this payroll tax and that it was going to be taking 58 cents of every $100 I make, and then it might eventually take more than that because it's predicted to be insolvent. And one of the solvency plans is to raise the tax higher and higher or lower the benefit. So a lot of us just haven't thought about it. I think as the state creates more awareness, as it has done, which is great, more of us will think about it and pursue plans for funding long-term care. And again, some of us do that through long-term and care insurance programs. Some do it through assets and other savings. I think a real drawback to this whole argument is that the state has made it be about what's better, our program or a private long-term care insurance program. Those aren't the only options. We all have options. We all have choices we can make about where our money goes and how we spend it. And thank you.
And that'd be great. Okay, so now Jess, 4 minutes of response.
Thank you. Thanks, Elizabeth. I think the reason that you hear proponents of the program always coming back to comparing this to long-term care insurance is that, we have to look at the reality here, and the reality is there are very limited options. There's Medicaid, which you have to spin down into poverty in order to access, and we're essentially incentivizing people to impoverish themselves. Or there's long-term care insurance, or there's paying out of pocket. Those are the choices. Let's be real. And who can afford those? We know that people who are higher earners are more likely to be able to afford to pay out of pocket. We also know that people who have private insurance, while there may be some more affordable options out there, and I'd love to hear, how much you pay, Elizabeth, for your policy, because it's hard to imagine it being less than $24 a month, which is what the median worker would pay into WACARES. So there are really those limited options. And when you look at them, WACARES is an obvious benefit. The problem with the private insurance market is that even if you were to get an inexpensive policy, will it be there for you when you need it? Considering all of these insurance companies becoming insolvent, pulling out of Washington state, because they have underestimated the number of people who will actually claim policies and require long-term care. The other huge problem with the private insurance market is that it cannot cover everyone. If you have cancer, Alzheimer's, MS, any of these things, you will not get covered by an insurance company. We pulled approximately 800 complaints from the Office of the Insurance Commissioner on long-term care insurance programs where people had been denied coverage. One man was denied coverage because of his build. He was a high school football coach, so apparently your build can get you disqualified for coverage. The other big problems that we saw in those complaints was that insurance premiums were going up and up and up. And what happens if you can't keep up with your premium? You're cut. If you're late, you're cut. So many of those people say my policy was canceled and I was never even contacted by my insurance company. I've paid in thousands, tens of thousands of dollars, and now I have nothing to show for it because of a cancellation. The other problem with private long-term care insurance is it doesn't offer the flexibility that WACARES does. It will not pay for a family caregiver. So when we talk about bringing that unpaid labor back into the workforce, that only happens through WACARES because the majority of private insurance companies will not pay for family caregivers, and most won't even pay for in-home care. So maybe you have a bigger benefit, but you're having to spend it in a nursing home and it's not going to go as far. I agree completely with some of the issues that Elizabeth raised around improving the program. The near retirees is a huge one. And this past legislative session, we were able to bring near retirees into the eligibility infrastructure by giving them 10% of the total benefit amount for every year that they work in. And because there's a 10-year vesting path, that tracks with what the lifetime benefit would be. And though you heard that that doesn't do enough, that actually covers an additional 1 million near retirees in Washington state that are now being brought into the program. The other issue that Elizabeth raised was portability. And the legislature and the Long-Term Care Services and Support Commission, which is a bipartisan body made up of Republican and Democratic legislators as well as stakeholders, that was formed to oversee WACARES, is studying portability. They study it with Milliman and other leading experts from around the nation, and will be making recommendations to the legislature moving forward. And while there are challenges to that, we believe that it's something that can be solved and that we shouldn't scrap the whole thing because of this one issue.
All right, thank you very much. Now we'll shift back over to Elizabeth for 4 minutes before we go into our closing.
All right. Thank you, Jess. The great news about all this is everyone has good intentions. And that is the way it is with most public policy, right? We see many of the same problems and we see different solutions for fixing them. Jess asks, will it be there when you need it, about long-term care insurance in the private market? And I ask the same of the states. Will it be there when you need it? Paid family medical leave is shown to be insolvent, even though we've all been paying into it on our payroll taxes. Now the general fund is taking it over. Will it be there when we need it? Will the price we're taught to rely on, $36,500, which is already inadequate, is that going to be the same? Can we rely on that? I don't know. They're already talking about changing it and lowering it and changing the tax. So I don't think that's, again, you know, this is not the only way long-term care insurance, private or the state program, this is not the only way to save or invest in long-term care. In fact, many of the 500,000 people who have opted out of the tax, given a provision to do so if you had your own long-term care insurance, don't really want long-term care. Many of them don't want long-term care insurance. They would rather put their money in property or in another asset that they can bank on that makes a higher return, has a better return on investment. So there are other ways to save your money and invest your money, and we should not be looking at this as an either or. Another thing I wanted to say in response to Jess's argumentation was that this is not a jobs program. It is not my job to pay for family members who are caring, and it is not the government's job to create a reliance on it. If we all rely on it, it's not going to work out. We need safety nets to handle the needs of people in need and not everyone. One of the most interesting arguments I find from the state public relations campaign around this program is that a person shouldn't have to rely on their money or spend it down to qualify for Medicaid. That's so confusing to me. I was always taught that I save my money so I could use it for my needs, not so that I could hand it down to my kids and make the government pay for my needs. I think it makes sense that you have to pay down to qualify for a safety net. And I think if we start to fix some of the things that make the Medicaid program easily abused by people who have a savings and have an ability to pay for long-term care, that's a good move and an appropriate role of the state. Am I at the time? I didn't time myself.
You've got 1 minute left if you want to use it.
Look at that. I guess one of the other things I would want to address is that everyone does not equally benefit from this plan. As we've already discussed, if you move out of the state, you won't benefit from this plan. People who don't need long-term care, lucky them, they won't benefit from the plan. So you're putting money into something you may not need, and it is not uniform. The other thing I thought it was with the Medicaid, while Medicaid will save money, it might not. If we're all relying on this $36,500 that we might not need and might not get, we may be getting more people on Medicaid who think right now that they have a sense of security with this long-term care fund that they don't.
All right, thank you very much. Thank you both. Now we're shifting into our final round, our closing cases. You'll each have 5 minutes to basically summarize your case and give us a reason to either vote for the affirmative and support the Washington Cares Fund, or vote for the negative and not support the Washington Cares Fund in its current iteration. So with that, we'll shift over to Jess, and you have 5 minutes whenever you're ready.
WA Cares is a first-in-the-nation social insurance program that other states in our nation are modeling their own programs after. We should be celebrating it. Yes, it is funded by a tax, but we have to change the way we think about taxes from being a grab by government to being important ways that we contribute to the health and well-being of our communities. All homeowners pay property taxes that help us fund public education, even though not all of us will use it, because we know that educating our communities benefits everyone. WA Cares is the same. We all pay into it, not just for ourselves, not just because of what we will get out of it, but for the good of our community. Long-term care social insurance isn't a new idea. Other nations like Germany and the Netherlands have similar programs and great health outcomes. The difference here is politics. A strong anti-tax movement that stokes fear and distrust of government. At the time that the Long-Term Care Trust Act passed in 2019, there was no vocal opposition. We haven't heard from any of these folks until now. But now for-profit insurance companies and political interests are swooping in to undermine this program. Insurance lobbyists convinced legislators to add the new opt-out window to the law in 2020. With this new language, long-term care insurance brokers rushed to push employers and consumers to purchase expensive long-term care policies and paying big dollars to promote misinformation. Insurance brokers are also linked to the plaintiffs in a lawsuit challenging WACARES. Republican and Trump political donors backed the ballot initiative that the professor mentioned earlier, I-1436, an initiative to the legislature to take away long-term care coverage from millions of Washingtonians. Despite the over $500,000 that they raised, the initiative failed to gather enough signatures to move forward, which I think says a lot about public support in and of itself. Again, according to the poll by AARP last year, a majority of Washingtonians support WACARES. Further polling shows that the public doesn't want to eliminate the program, but to improve it. Is WACARES perfect? No. It will require adjustments and improvements along the way, just like any new, innovative, far-reaching public program. The Long-Term Services and Support Commission is study's option for improving the program. Based on their findings, the commission makes recommendations to the legislature, including 2 important changes to the law, the exemptions that were mentioned earlier, and extending benefits to the near retirees. In closing, I want to share a story with you. When Christina Key's mom was 62 years old, she had a sudden and debilitating stroke. She had long-term care insurance, which really reassured Christina, but her mother's insurance didn't cover in-home care. Within 2 years, both Christina and her mother had drained both of their 401ks, and they were holding garage sales and GoFundMes to help pay for care. Christina had to leave her career and take a part-time job that would give her more flexibility in order to care for her mother. In her late 40s, Christina is now making the same wage at her part-time job that she did when she entered the workforce at 16 years old. We must shake the mentality of this isn't going to happen to me. If you aren't a caregiver now, it's very likely that you will become one in the future. And if you don't become a caregiver, it's likely you'll be the one needing care. Imagine yourself or your mother in that situation, and then ask, is WACARES good for Washingtonians? I think the truth is self-evident. Thank you.
Thank you very much, Jess Gomez. And for our final closing, Elizabeth Hovde.
Hi. First of all, I don't think that the long-term care insurance market aggressively went after people to get long-term care programs. I think they were consulted and they tried to rise to the challenge. Their industry has been altered significantly by the state entering the market. In closing though, the more people hear about Washington's coming long-term care law and payroll tax, the less people like it, and for good reason. A class action lawsuit was filed against it, an initiative was being pursued, and Idaho sent the state a cease and desist order concerning the law that even impacted workers who live in other states. Starting in January, the unpopular law was supposed to impose a stiff new tax of 58 cents per $100 earned for every W-2 worker in the state with no income cap. The money would go to a new program called the Washington Cares Fund, providing limited long-term care services, whether participants ever need them or not. There's more not to like than the tax. Lawmakers and officials have concerns about program solvency, and they are already talking about the possibility of raising the tax or cutting program benefits. And the benefit is paltry at $36,500, enough to pay for a little more than 3 months in a nursing home. It's true that Washingtonians need to plan for their long-term care needs, just like other aspects of life. When that doesn't happen, Medicaid is often used, and more people in our population are tapping this limited safety net to avoid using their assets or kids' inheritance on their long-term care. But Medicaid is a state program created to provide for people who are in need. It's not a health or long-term care plan for the not needy. Many Washingtonians will need long-term care, but lawmakers failed in two significant ways with this law. First, Washingtonians used to have access to private long-term care insurance should they want it before the state killed the market in Washington state. Most people weren't buying it. Many people plan for long-term care in a different way than buying long-term care insurance. Also, state rules play a role in making it expensive. Remember, not everyone needs formal or informal long-term care in their lifetime. And as the state itself explains, some will only need it in a limited way or for a short time, and many will get help from their family members. Oftentimes, another investment will seem wiser than long-term care insurance for an individual. And taking away more workers' income makes it harder to have investments or savings. Heck, this regressive tax makes it harder for low-income people to put food on the table. For the many of us who would make a good bet in long-term care insurance, keeping regulation and government competition away from the private market will help it provide the kind of insurance that consumers seek. And I do think more of them will now seek it now that we're aware of how many of us need it. Offering workers an incentive for having such a plan and decreasing the state's burden is also a great idea. The law says that seniors must rely on family care and spend their life savings down to poverty levels in order to access long-term care through Medicaid. But it just seems like some state lawmakers want to make people more dependent on the government. Shouldn't we try to rely on ourselves? Shouldn't we use our life earnings when possible to pay for things we need? Suggesting otherwise is foolish, and it takes away funds for those who are most in need. The state's marketing for this program tries to convince the public that this is the first in the nation program that solves the long-term care problem here and offers peace of mind to individuals, but it doesn't. There's a reason that this is the only social program like this in the nation. It's not an attractive solution. Thank you.
Thank you both very much. We have done a couple of debates this quarter. This by far, we've analyzed a bunch. This was by far the best, most detailed. This was a fantastic debate. Y'all should take it on the road as part of a public information campaign.
We called us.
We'll talk after.
So I just want those of you on Zoom and those of you in the classroom to join me in thanking our two debaters today.
Thank you.
Thank you. Thank you for having us. Thank you, Elizabeth. Nice to meet you.
Nice to meet you.